And you see that posture right there? We call that a decebrate posture. When the spinal cord has been compromised, you see how you get the extension of the ankle? Yeah, that guy's a goner. Yes. So one of the common questions we get is about sleeping posture, and it's a posture that people often overlook as a source of either continuing problems and pain or actually causing problems and pain. Oftentimes people that have shoulder pain that have no obvious injury, it turns out that they tend to sleep on that shoulder. So we're going to go through a couple different postures, keeping in mind that everybody's different and has different levels of mobility, and if you have a posture that you're comfortable in and it allows you to have a good night's sleep, then by all means keep sleeping in that posture. But there's a couple things that I want to point out that are common to everybody. So Joe's going to work with us here. So let's have you lie down on your back first, Joe. The first thing I want to demonstrate, we talked about, let's have you lift up just a little bit, now down. So we talked initially about the forward head posture. What's really common is when people lie down, now these are kind of flat pillows, they have too much of a pillow, they tend to put their head in that thrust forward position, and that can create some difficulty. So one of the suggestions is always make sure the pillow starts under the shoulders and you have enough support here. Have a pillow that you can adjust to give you some support. Sometimes I'll even recommend people take a towel, okay, you relax, and you have a towel between the pillows as a way to support the neck. Many people have difficulty sleeping on their backs, so that could be a problem. If you have a shoulder problem and you can't sleep on your back, what might be helpful is what I call kind of the half side-lying, half supine position. So Joe, I'm going to have you roll to your left side there. And what we can do is we can prop a pillow here, and now let's have you come back this way. This way the weight bearing isn't directly on his left shoulder. His neck is in a good neutral position and he has some support. And varying degrees of rolling towards that left side can be a nice adjustment to try to get comfortable, and sometimes even putting a pillow between your knees can be helpful. Joe, let me have you lie on your left side all the way. So the challenge that one gets when you're lying on the side is making sure, again, that the neck is in a neutral position. But the true challenge is, particularly as we get older, my age and up, I'm pushing my 6th decade, is lying on that shoulder. You can compromise the circulation to some of the rotator cuff muscles. You can compress the joint between your collarbone and your scapula, the acromioclavicular joint, and that can become problematic and painful. The other thing is you can compromise the circulation to the hand and the arm. So let's have you back on your back, Joe. The other position that you want to be careful of is sleeping on your back with your arm over your head. We demonstrated some exercises to stretch out that pec. There's a main artery that runs right in underneath the collarbone into the armpit, and when you stretch that arm up, you can stretch that artery, decreasing the circulation to the upper extremity, the hand and the arm, and that can be problematic. So sleeping with your arms up like that, oftentimes you'll find that your hands will go numb. That can be problematic, and you want to make sure you try to avoid that. And it's the same thing when you're lying on your stomach with your arm elevated. You're compressing your shoulder and you're compromising the circulation. So the ideal position really is sleeping on your back with your neck in a neutral position, and then some variation of that to try to adjust based upon your individual body type. Our promise at Petersen Physical Therapy is with unconditional positive regard to meet our patients where they are and help them move forward, to help you move forward. So hopefully the information we presented today is helpful to you. If you're watching on Facebook or YouTube, please subscribe, like, and share. All the stuff you do to get the word out on what we're doing. It's really helpful and we appreciate it.